Understand the early signs and symptoms of a heart attack. In this video, I will teach you the 7 symptoms your body gives before a heart attack. Hello, my name is Dr. Marcos and welcome to the You Stronger channel. Heart attacks are the leading cause of death worldwide. According to the World Health Organization, cardiovascular diseases cause approximately 17.9 million deaths each year. The sooner you understand and identify the signs of a heart attack, the faster you can get to the hospital, leading to better treatment, fewer heart complications, and a greater chance of survival. Pay close attention to this video. Along with the early symptoms of a heart attack, I will discuss the different types of heart attacks, the causes behind them, and why there has been a worrying increase in heart attacks among young people under 40 in recent years. But before sharing this information, subscribe to my You Stronger channel, leave a like on this video. I need as many likes as possible to help reach and help more people. Can I count on your support? Some data shows that less than 5% of the population can recognize the first symptoms of a heart attack, and many lives are lost because of it. Let me know in the comments if you've ever had a heart attack or if you know someone who has. What is a heart attack, or acute myocardial infarction, AMI? A heart attack can be a terrifying experience. If you've had a heart attack or been close to someone who has, you know how true this is. As I mentioned, heart attacks are one of the leading causes of death globally and are a medical emergency. The heart is a muscle that pumps oxygen-rich blood and nutrients to the rest of the body through the aorta. Surrounding the heart are several small arteries known as coronary arteries, which supply the heart muscle with oxygen and nutrients. During a heart attack, or acute coronary syndrome, blood flow is blocked in one of the coronary arteries. Atherosclerosis is the leading cause of heart attacks and results from the continuous buildup of cholesterol in these vessels over the years. Stress, a scare, vigorous exercise, or lack of sleep can trigger a heart attack. In the United States, it's well documented that during daylight saving time, when people lose an hour of sleep, there is a 24% increase in heart attack cases. When clocks are set back to standard time, there's a 21% decrease in heart attacks. Any of these factors can cause the rupture of a fatty plaque in the arteries. Once this plaque ruptures, platelets in the blood will respond and try to stop the rupture, leading to the formation of a blood clot that can partially or completely block the affected coronary artery. Other, less common causes include vasospasm, which can be triggered by drugs such as cocaine, smoking, stress, or cold temperatures, resulting in a sudden spasm of the coronary artery. Another cause is coronary artery dissection, where the inner wall of the artery tears, blocking blood flow. Any obstruction in the coronary arteries leads to ischemia in the heart muscle, meaning a lack of oxygen and nutrients for the part of the heart muscle supplied by the affected artery. This can cause the death of the heart muscle, known as acute myocardial infarction. During a heart attack, heart muscle tissue dies due to a lack of blood flow to that artery. This is why we say time is muscle. The quicker you get to the emergency room and receive treatment, the less damage there will be to your heart. Conversely, the longer you wait to seek help, hoping the symptoms will pass, the greater the damage to your heart muscle. So, what are the symptoms of a heart attack? Often, people do not realize they are having a heart attack, either because they do not recognize the early signs or they do not consider them serious enough to call for help. This is why it's crucial to pay attention to your body. Some heart attacks are sudden and intense, but most start slowly, with mild pain or discomfort. The first and primary symptom is chest discomfort. Most heart attacks involve pain or discomfort in the center of the chest lasting more than a few minutes, typically 5 or more. This is not sharp or stabbing pain that lasts only a few seconds. Instead, it's a longer-lasting pain that may go away and then come back. This discomfort can feel like uncomfortable pressure, a weight, tightness, fullness, or even a burning sensation in the chest. The second symptom is discomfort in other areas of the upper body, such as pain or discomfort in one or both arms, numbness in the hands, pain in the back, neck, jaw, or stomach. The third symptom is shortness of breath. This shortness of breath can occur with or without chest discomfort because your heart struggles to pump blood effectively during a heart attack. You may experience breathlessness or difficulty breathing. The fourth symptom is cold sweat and pallor. This sweat differs from the typical sweat you produce during exercise. It's cold and clammy, and the person usually appears pale. You might start sweating suddenly, out of nowhere, with cold, moist skin. The fifth symptom includes nausea and vomiting. You may feel queasy or experience gastric discomfort, which is related to the response of the vagus nerve. The sixth symptom is dizziness. Dizziness can occur during a heart attack and is often described by women. Some women report feeling as though they might faint if they try to stand up or exert themselves even slightly. The seventh symptom is anxiety. You may feel a sense of impending doom or panic without any apparent reason. If you experience any of these symptoms, do not wait for them to pass. Call for emergency help, reach out to a family member or friend, call a taxi, or take an Uber to the emergency room. In cardiology, there is a concept known as the golden hour, during which a person's survival depends on the actions they and their doctor take within the first hour of the event, as most deaths from cardiac arrest occur during this period. When it comes to the difference in symptoms between men and women, chest pain, angina, is the main symptom of a heart attack for both genders. However, women tend to describe the pain as a squeezing or pressure in the chest, while men often describe it as a heavy sensation. Additionally, women are more likely than men to experience shortness of breath, nausea, vomiting, and pain in the back and jaw. Fatigue is also one of the most common symptoms in women, to the extent that some may mistake their heart attack symptoms for those of the flu or COVID-19. It's important to note that not everyone experiences the same symptoms during a heart attack. Some individuals may have mild pain, while others may have more intense discomfort. In certain cases, such as with diabetics, they may not even experience chest pain at all. We also have cases where the first sign of a heart attack can be a cardiac arrest. However, the more signs and symptoms you have, the higher your chance of experiencing a heart attack. Some heart attacks occur suddenly, but many people present warning signs or symptoms hours, days, or even weeks before the event. The first warning may be recurring chest pain or pressure, known as angina, which is triggered by exertion and relieved when the person rests. If you can recognize these symptoms early, it can be even more beneficial before a heart attack occurs. There are two types of heart attacks. The first is ST segment elevation myocardial infarction, where a clot completely blocks blood flow to a specific artery. In this case, doctors can see through an electrocardiogram that you are having a heart attack. Because this type of heart attack is more severe, prompt action is required. The second type is non-ST elevation myocardial infarction, where there is a partial blockage of the artery. Unfortunately, this type does not show on an ECG, but the muscle is still suffering, and cardiac enzymes like troponin will rise in a blood test. What are the risk factors for a heart attack? As mentioned earlier, the primary cause of heart attacks is atherosclerosis. Therefore, factors that contribute to atherosclerosis increase your risk of having a heart attack. Risk factors for heart attacks include age. Men over 45 and women over 55 are at higher risk. Women tend to have problems later because estrogen provides some protection. Smoking, which includes both active smoking and secondhand smoke, high blood pressure, and prolonged high blood pressure damage the arteries that supply blood to the heart, leading to atherosclerosis. High levels of LDL cholesterol, the bad cholesterol, low levels of HDL cholesterol, the good cholesterol, elevated triglycerides, and high lipoprotein levels all increase the risk of atherosclerosis. Obesity is linked to elevated cholesterol levels in the blood, as well as high triglycerides and high blood pressure. Visceral fat can also cause inflammation in the body, raising C-reactive protein levels, which is a cardiovascular risk marker. Diabetes, over time, can damage blood vessels and nerves in the heart due to high blood sugar levels. Family history is extremely important. If your siblings, parents, or grandparents experienced early heart attacks, you may be at an increased risk. This can increase your chances of developing significant atherosclerosis by 4.5 times. Lastly, physical inactivity contributes to hypertension, obesity, diabetes, and high cholesterol levels in the blood. People who exercise regularly have significantly better heart health. Stress is a major villain, as it causes inflammation, increases blood pressure, raises blood sugar levels, disrupts sleep, and ultimately elevates the risk of a heart attack. Additionally, the use of drugs like cocaine and amphetamines can trigger spasms in the coronary arteries, leading to a heart attack and, in the long term, contributing to atherosclerosis. But why has the number of heart attacks among young people increased? According to the Ministry of Health, between 2010 and 2019, before the COVID-19 pandemic, there was an alarming 59% increase in hospitalizations for heart attacks among people aged 39 and younger and nearly a 10% increase in deaths. This is due to the rising prevalence of risk factors such as hypertension, diabetes, high cholesterol, obesity, stress, smoking, and sedentary lifestyles, which are becoming increasingly common among young people. This dangerous lifestyle is directly related to the issue. It's also important to note that in this age group, symptoms of angina, like chest pain while walking, may not occur before a heart attack. What treatments are available for a heart attack? The treatment for an acute myocardial infarction usually involves administering oxygen and therapies that increase the amount of oxygen reaching the heart muscle. Medications such as aspirin or other antiplatelet drugs, nitroglycerin, and morphine are used to relax the coronary arteries and relieve pain. Beta blockers help reduce heart rate and cardiac oxygen consumption. In some cases, the doctor may opt for thrombolytic therapy to dissolve blood clots or, preferably, if the patient is in a well-equipped hospital, perform coronary angioplasty. In angioplasty, a long, thin catheter is inserted through an artery to reach the blocked coronary artery. The catheter has a small balloon at its tip. Once the catheter reaches the appropriate location, the doctor inflates the balloon, compressing the fatty plaque against the artery walls, which increases the space for blood flow. Stents, which are like small metal springs, expand and cover the plaque, acting as tunnels that prevent the fatty plaque from narrowing or closing the artery again. How can you reduce the risk of having a heart attack? The answer lies in reducing risk factors. Approximately half of heart attacks can be prevented simply by making some lifestyle changes. This includes adopting a healthy diet, maintaining a healthy weight, and being physically active. If you quit smoking, you can reduce your risk of a heart attack by 30%. It's essential to keep your blood pressure under control. If you have diabetes, managing your blood sugar levels is crucial to avoid the harmful effects of the disease. Eating a healthy diet with low sugar, sodas, salt, and fried red meats while increasing your intake of fruits and vegetables can help lower your cholesterol and triglycerides. Get moving and incorporate physical exercise into your routine. Try to lose weight if you are overweight or obese. Aim for 7 to 9 hours of quality sleep each night and foster friendships. Research shows that loneliness and social isolation can increase your risk of a heart attack by nearly 30%. Regular cardiological checkups are also important. If your parents have had early heart diseases, you should start monitoring your heart health earlier, around the age of 20. Today, cardiac tests are more reliable than ever. In the past, we relied on non-invasive tests to infer whether a patient had blockages, such as stress tests. Sometimes, patients would perform exceptionally well on these tests, showing no chest pain or changes in their heart rhythm, and yet they would suffer a heart attack shortly after. Now, we have more advanced examinations, like coronary CT angiography, which reveals the condition of the arteries internally and identifies any plaque buildup. This test is less invasive compared to catheterization, which is a very effective but invasive procedure. However, coronary CT is not suitable for everyone. It involves radiation, requires contrast material that can cause allergic reactions or kidney issues, and is relatively expensive. Nonetheless, it's crucial to know that we have these advanced options available when necessary. Finally, I want to emphasize the importance of having an emergency action plan for those at high risk of heart attacks or those who have already experienced one. Keep a list of your medications and any allergies, and know who your doctor is. What does your baseline electrocardiogram look like? Take a photo and save it on your phone. Identify the nearest hospital to your home that has cardiologists and an emergency hemodynamic team. This information can help ensure that you receive medical care as quickly and effectively as possible, potentially saving your life. I hope this video has been helpful for you. Please share it with a friend or family member to spread the knowledge. Don't forget to subscribe to my channel. This will help this content reach more people around the world. Thank you very much. Legal disclaimer. This video is for educational purposes only, aimed at instructing the public on various topics related to medicine and general health. The information provided in the videos is not intended to replace medical consultations or serve as recommendations for any treatment plans. If you have any questions, please consult your doctor. Medicine is a constantly evolving field, and the videos are based on the most recent scientific articles available at the time of production. The videos are strictly for educational purposes only and do not disclose addresses or phone numbers of any office, clinic, or service.